Hi, my name is Adam Levitt. I'm a board-certified vascular surgeon at Vascular Specialists of Central Florida. One of the common conditions that is referred to us is people with carotid disease, carotid stenosis, a narrowing of the arteries. The carotid arteries are one of the 4 blood vessels that go to the brain. You have a carotid artery on either side of your neck, and then you have vertebral arteries in the back of your neck. They all supply the blood supply to the brain. If there is a narrowing of the carotid artery, it puts you at a higher risk of having a stroke. As that narrowing gets more and more, your risk of stroke goes up. So some patients are referred to us for carotid stenosis. When you first come to the office with that diagnosis, we'll first meet you, introduce you, answer questions. I will do a complete history and physical. And if you haven't had an ultrasound, we'll get an ultrasound, which is just a probe that's placed on the neck to look for the blockage. Once we have the ultrasound, if it does suggest that you have a very high-grade blockage or narrowing of the artery, then the next step usually is to order a CT angiogram or a CAT scan where they inject some dye so that we can look objectively about how much exact narrowing you have. And that all helps us determine your best treatment plan. People with carotid disease are either asymptomatic or symptomatic. Asymptomatic disease means, again, asymptomatic, no symptoms, but you have the blockage. For these individuals, we usually will not intervene surgically until you have a greater than 80% stenosis. You will be treated medically, which is usually with an antiplatelet, usually a baby aspirin, and a statin medication for your cholesterol to control that. We also will do ultrasounds to follow the narrowing. Depending on how narrowed you are, will determine how often those ultrasounds are done, usually somewhere between 6 months and a year. And then one of the #1 things that people need to do is to quit smoking. Symptomatic patients are, again, having symptoms, so that would be stroke-type symptoms. All of a sudden losing strength in an arm or leg, inability to speak, losing vision in one eye. That can be permanent or can be just transient, meaning less than 30 seconds. That's considered a symptom. Again, patients will be treated the same way medically, but then based on that, we'll determine that most likely if they have a greater than 50% blockage, they most likely will need some kind of intervention.